Government can and must provide opportunity, not smother it. Foster productivity, not stifle it.
Well, I've said it before, and I'll say it again. America's best days are yet to come.
From Delmar to Middletown, Bombay Hook to the Brandywine, Dover to Wilmington. This is the Caesar Rodney Institute Policy Podcast. Sam Friedman, Caesar Rodney Institute Communications Director, talks with Dr. Chris Casscells, Director of the Center for Healthcare Policy at the Caesar Rodney Institute, on the continuing and expanding problems with Obamacare.
Let's go to King versus Burwell. That case will be judged by the Supreme Court sometime next month. Where do you think the court is going to go?
Well, first to summarize, this is a lawsuit being brought by somebody who professes to have been harmed by the IRS not following the strict writing of the law and basically giving away a lot of money. So the lawsuit is in support of the Affordable Care Act, the Obamacare legislation. So the Supreme Court, by all rights, should probably say the law is as it's written and support King. The problem with this is that the law was completely written by one party with no support of the other party. So if and when the Supreme Court does support the law, they will in fact destroy the law.
And can you just explain how that would happen?
Well, the way it happens is that all the people who've been getting subsidized insurance now may have to pay it back to the IRS because they illegally got money from the IRS. One way or another, they will not have health insurance going forward. So the people who need health insurance desperately will continue to pay the premiums, but those are the money losers for the health insurance. And so you get what's called the death spiral, where the only people who are actually purchasing the insurance are the ones who spend tons and tons of healthcare dollars. And the healthy or the immortal young who don't really need health insurance or don't have healthcare costs, they just simply stop paying it because, number one, they don't have to. Number two, they cannot be fined. And number three, they don't feel like spending cash for something they don't really need. So that's called the death spiral in the insurance industry.
Yeah, nice. I don't know if you saw the an article in the News Journal within the last month or so about how Delaware was lagging behind the rest of the country in terms of getting these quote-unquote young invincibles like myself to sign up for their exchange program. What is it about Delaware's health exchange that's not really appealing to younger and healthy people?
Well, Delaware hasn't really hit the wall, if you will. So Delaware has not been able to really successfully market, nor has it had any reason to want to market to the young invincibles, because Delaware does not run its own health insurance exchange. It piggybacks onto the federal government's exchange. So Delaware is particularly vulnerable to this King v. Burwell ruling. Delaware is also a little bit vulnerable because in order to comply with the ACA, the Obamacare legislation, it expanded its Medicaid rolls, but that's a very temporary source of money that will benefit the current Delaware administration, but it disappears within a couple of years, so future administrations in Delaware are going to have to pick up a lot of Medicaid cost that this administration will have deferred to the federal government.
Well, one of the ways that the state says that they're going to resolve it is through their Delaware Healthcare Innovation Plan. They just got a $35 million grant from the state. What do you know about this plan, and what do you think will be the effect if they were to actually implement it?
Well, the Delaware Healthcare Innovation Plan grant was leftover stimulus money, and a lot of it went out at the very last minute. It wasn't going to be available any longer. And Delaware deserves credit for having put together a grant proposal and having gotten this grant money, but it's a one-time stimulus package things, rather like transportation monies that they're sort of ending right now. All the stimulus money is sort of running out, so you're seeing a lot of road work going on. Well, it's the same thing with the innovation plan. The innovation plan basically says we are going to deliver a more quality product to more people at a lower cost, which sounds wonderful. I mean, who could possibly object to that? The question is it doable? And I can give you a really good example of it. One of the areas in which the hospital exists, Christiana being the major player in the Delaware market, essentially the 800-pound gorilla in the room. Christiana does a lot of cost shifting. In other words, they pay for cost-losing services to a lot of people with certain profit centers within the system. Often the fees that are charged in the profit centers are big markups, big multiples of what the actual cost is in order to cost shift and provide services to other people. Well, whenever you look at that kind of scenario, you say, well, let's save money by not purchasing things at such a high price. We'll purchase them cheaper. But you see, the hospital marks up those purchases by several factors. So even though they're saving money by not spending as much for the purchase, they're losing money by not being able to charge as much for it on the other end.
So what can the state, or should they be doing in order to really keep the cost of healthcare down and make it more accessible?
They really need to have a longer vision, and they need to get everybody some skin in the game. People who expend great amounts of money in the healthcare system need to have to be disincentivized from ruining their own health. I mean, the cigarette tax is a wonderful example. You raise the price of cigarettes to $5, $6 a pack over what it was when I was a kid, 25 cents a pack, and guess what? People stop smoking. And that's a good long-term plan to reduce the cost of lung cancer, for instance. That's not really happening. Unfortunately, on the political end, people tend to look political season to political season. On the insurance company end, people tend to look quarter to quarter for profit momentum, for earnings momentum. And these aren't long-term visions. The long-term vision would indicate that you need to go back to a much more a system where people have skin in the game, where you pay for what you get, and then you provide a safety net underneath that. Otherwise, people spending other people's money will drive the cost out the roof, which is what's happening.
All right, Chris. Well, thank you so much for your time and joining me today.
Thank you, Sam.
That was Chris Casscells, who is the Director of Healthcare Policy here at CRI, and he is also a practicing orthopedic surgeon. You've been listening to the Caesar Rodney Institute Policy Podcast. You can check out our website at caesarrodney.org, and don't forget to subscribe to our YouTube channel so that you can stay up to date on all of our latest podcast episodes and other videos. I'm Sam Friedman. Thank you so much for joining us, and have a great day.